This is SSN
Story Studio Network.
Welcome to the Fatigue Fixer podcast. Have you ever wondered why you and most of the women you know seem tired so much of the time? Well, this is the podcast where we explore why. I'm here to help you better understand how your body works, whether we're talking about heavy, painful periods, why you have to pee all the time, or what the heck is happening to your body through perimenopause. And I'm not afraid to shed light on conversations that I feel we need to be having out in the open. Like, why are so many women struggling with irritability and anger, drinking more alcohol, and injecting our faces with Botox and fillers in an attempt to stay young? I'm your host, Dr. Sarah Vadeboncoeur. I'm a naturopathic doctor, mom, fatigue fixer, and loud and outspoken woman who's fascinated by the state of modern women's health and well-being. I know that you, yes, you, are incredible, and I want you to have the energy you need to share your unique gifts with the world because we are in desperate need of more female leadership. So join me for conversations that will help you feel less alone, more informed about all the things that might be draining your energy, and inspired to fix your fatigue and wake up every morning feeling rested and excited for the day ahead. I can't wait to share today's episode with you, so let's get into it. Tell me if you can relate to this. You know where all the bathrooms are at your favorite stores. You always pee before you leave the house. I call this the just-in-case pee. You're waking up at least once a night to pee, and by the end of a long meeting, you're beelining it for the bathroom because you just always have to pee. Last year, I was part of a panel discussion on women's health, and a pelvic floor physio said something that was a major aha moment for me. If you want to pee less often, she said, stop peeing when you don't have a full bladder. AKA, stop doing the just-in-case pee before you leave the house or before you go to bed. Being the good student that I am, I took her advice and ran with it. And within a couple of weeks, I noticed that I was able to go several hours without peeing, whereas I'd normally been someone who peed every 1 to 2 hours. I remember being at a concert and realizing I hadn't peed in 4 hours, where normally I would have peed before the concert, at the intermission, after the concert. I had to know what was happening and how this worked. So I posted to my Instagram and tagged my go-to pelvic floor expert and our guest today, Lisa Flanders. So stay tuned to find out why that just-in-case pee is messing up your bladder. This is the one where your vagina is dry and you pee all the time. And even if your vagina is still juicy and happy, I want you to listen because pelvic and bladder health is important for women of all ages. And when you're 50 and 60 years old, you will be so happy that you got the information you're about to hear in today's episode. My guest today is Lisa Flanders, pelvic floor physiotherapist and owner of Bloom Integrative Health and Movement Center. Her team was my go-to during my pregnancy and postpartum, and I refer patients for pelvic floor physio all the time because most women don't realize that peeing your pants when you sneeze, peeing all the time, or having discomfort with sex isn't normal. And so many women aren't getting restful sleep because they're up peeing several times a night. So in continuing with this season's theme of exploring things that are not normal, but that we've normalized as part of the female experience, today we're talking all things bladder and vagina. Lisa, welcome to the Fatigue Fixer podcast.
Thank you, Sarah. I'm so excited to be here and to talk to you about all things to do with pelvic health, pelvic floor, bladder, and sex.
I love it. You were the person I wanted to have this conversation with. So what is the problem with doing the just-in-case pee? Why is this a problem and what's happening when we do that?
So there are typically a couple things that can be happening. So first, there are the just-in-case pees. The second are what I call the nervous urgency. So I'm nervous about something. I have to do a presentation. A class at the gym is about to start and I'm going to run to the washroom just in case. But it's because I'm nervous. What happens when we regularly empty our bladder before it's full is that the bladder never gets to experience a full amount of stretch. Just like any other muscle, if we fail to stretch it regularly, it's going to become shortened and it's going to feel like it's stretching when it's not really at its full capacity to stretch. So the bladder is a muscle. It's an involuntary muscle, but it's a muscle all the same, and it does have to be trained how to stretch as well. So when we're going, when the bladder is half full or a quarter full, what happens over time is that when your bladder is only half full, it sends a signal to your brain saying, I'm full. This feels uncomfortable that I am stretching a little bit more than I feel is normal. And so I better go now. And so over many, many, many years, we train ourselves to go exactly what you just said, just in case. This actually often starts with childhood, especially little girls. I'm sure a lot of your listeners can agree with this. And if anybody has daughters, stop doing this with your daughters now, that you were going to go in the car to the grocery store and your mom would say, Sarah, do you have to pee? And you would say, no, I'm good. And she would say, well, let's just go just in case, because it's a lot more challenging to pull over on the side of the road with a little girl than it is with a little boy. And so this starts at childhood, and then it really just continues on as we get older and older. And this was something I definitely struggled with until I became a pelvic floor physio.
Yeah. I think there's a lot of people listening already who are like, oh my gosh, I do this all the time. And you're right. And I noticed I was doing this with my son, and I've stopped doing this with him because I'm like, I don't want to do this. The good news, which is what you're saying and what I've already experienced, is that we can retrain our bladders, correct?
Absolutely.
Because it's a muscle. So how do you kind of, if women are doing all of these just in case pees, part of what I've been encouraging, but I'd love to hear your thoughts, is waiting until they really feel like they have a full bladder. So really trying to eliminate the just in case pees. And what I noticed actually very quickly is that I was able to hold it a lot longer. So how do we help retrain our bladder so that we can go without peeing for a little bit longer?
Yeah, it's exactly what you said. So we start working with something called urge deferral. So when that person starts to experience that urge to urinate, we try to defer it for up to about 15 minutes at a time. We don't want them to feel uncomfortable. We don't want them to end up in a situation where they cannot go because there's no bathroom. So I always encourage people at first to do a bladder diary, because I want to see when they're urinating, like what time of the day they're urinating, how long they're actually urinating for. I have them count 1,000 to 1,000, whatever number. And I track that. I get them to track it for usually one weekday and one weekend day, because weekdays and weekend days are typically a little bit different. And then they bring that back to me at their next appointment, and we go through it and we identify the times that they're clearly going just in case. So for example, if someone in the morning takes 20 seconds to urinate, and then at 10 a.m., we see that they're going 2-3 times, and those are 5-second pees, we know that their bladder's not actually full. So then I say, what happened at 10 o'clock this morning? And they'll usually let me know, oh, well, I was going to go for a walk with my dog. So I went before, and then I went again just in case after I got the dog's leash on. And then went again as soon as I went home. So those are the times that they've trained themselves like, oh, I'm not going to be around a bathroom. I should go and empty my bladder. So we start to defer those, and we defer those very simply through pelvic floor muscle training, having someone do 5 Kegel contractions. When we do an appropriate Kegel, what that does is it overrides the bladder signal to the brain, and it actually will shut off temporarily that urge to urinate. It might only happen for a minute. It might happen for 5 minutes. The goal is to get up to about 15 minutes. If then you still have to urinate, then you have permission to go to the washroom. But slowly, it allows the bladder to feel that stretch over time and essentially be able to hold more fluid.
Yeah. I think what's so eye-opening about this is that in our attempt to not have to pee at the grocery store, we make ourselves have to pee more often just in general, right? We're actually doing the thing that will make us more likely to have to pee all the time. So it's totally counterproductive the way that we we've been doing it.
Absolutely. The other strategy a lot of women use is they will decrease their water intake.
Fluid.
They go, oh, well, I have to pee all the time, so I'm going to drink less water. Well, that's really counterproductive because now we have a bladder that's really trained to go on a small amount of urine. But on top of that, we have made that urine very concentrated. Now, concentrated urine is going to be is going to irritate the bladder more. And so now they're like, well, now I really have to go, but I barely had anything to drink. And so they're not hydrating themselves, which is like not good for all sorts of other health reasons. But now they're still having to go because they have very irritable urine in their bladder.
Yeah. Okay. So don't limit your water, but retrain your bladder, like Lisa said, trying to see if you can hold for an extra 15 minutes before you go. So what is normal? Like how often is it normal to go pee?
Now, normal is like a really hard thing to quantify. If we look at sort of a regular number of urinations throughout the day, we're looking at somewhere between 4 and 7.
Okay.
So it's actually not as many as people think. Now, I always say really like your normal is going to be very different. If you drink a lot of water, if you're a very active person, you might go more than that. If you, there's lots of reasons. I could give you a whole slew of reasons why people might go more, and that could still be considered normal. So that's where I like to look at a bladder diary. So get an idea of how many times a day that person is urinating. And when someone does a bladder diary, I also get them to track how many bowel movements they're having. Because if you are going, let's say at 7 a.m. when you wake up, you urinate, but then at 7:30 you go to have a bowel movement, but you urinate again, I don't actually count that one because it's kind of hard to turn off one part of your pelvic floor to allow the other one to work. But yeah, so we start by tracking it. And so let's say that person is going to the washroom 20 times in a day. If we can just reduce that to a more reasonable number, like 10, then I'm typically happy if they're happy.
Okay.
My very first pelvic floor client actually came to see me because she was urinating so much. And she wasn't so much concerned that she was going to the washroom all the time, but she was embarrassed that the same people at work would see her in the washroom. So she's like, I always run into Janet from whatever department, and I run into her 10 times a day. Or people would comment at someone's house like, oh, you're going to the washroom again? And so that was what her inspiration was for coming for physio. And we got her from like 35 times a day to like 7.
Yeah.
In a very short period of time.
Yeah, that's what I love about this. We can change this pretty easily and quickly. I also want to share, and you're jogging my memory with your story. I had a patient who couldn't make it to work without stopping to pee. So she'd literally get off the bus, go pee, get back on the bus. Wow. And I had the insight to ask her what kind of water she was drinking. And she was drinking distilled water. Oh. So the other thing that listeners need to know is that distilled water and reverse osmosis water that hasn't been remineralized will go straight through you. We really should not be drinking distilled water. So that's another thing I've learned to ask about is not just how much you're drinking, but what kind of water, because especially right now, there's all these like trendy, fancy waters, and some of them are actually problematic. So if you're listening, please don't drink distilled water. It is not meant for drinking.
Well, and that brings like another really good point up is also, and I'm not trained to teach people about diet, but this is where I absolutely send people to naturopathic medicine or a nutritionist or dietitian is what kind of diet they're having as well. If you're not having a lot of carbohydrates in your diet, which is, we know, a very popular form of diet, your water has nothing, the water has nothing to hold on to. Or if you're not having a lot of salt in your diet, the water has nothing to hold on to. So it's going to be going through your system a lot more. And I definitely find when I go visit my mom, who tends to be a little bit more low carb, and so that's how we eat when I visit her because she cooks for me and I'm not going to make my own meal. And when someone else is cooking for me from time to time, I definitely notice that like I will urinate a lot more, especially in the morning, because breakfast will be like an omelet, but no toast. And so there's just really nothing for my water to hold on to.
Yeah, that's very interesting. Can we talk about peeing at night? Mm-hmm. Is it normal to wake up to pee, or should we be able to make it through the night?
You absolutely should be able to make it through the night. I mean, there will always be times where you've had water a bit too late in the evening. And yes, you might wake up in the middle of the night to urinate. I would say, you know, for me, it's maybe those days that I haven't had enough time to drink water throughout the day because I've been very busy at work. And so, you know, 8 o'clock at night comes around, I'm chugging back a liter of water. And then of course, you know, 1 a.m. when I'm up urinating. So it absolutely can happen from time to time based on circumstance. But if you're following appropriate hydration throughout the day, then no, ideally you should not be waking up overnight to urinate.
Okay.
And then again, like you said, it's going to affect your sleep, which is not good for your health either.
Yeah. So I see a lot of women who are waking up not just once, but multiple times a night. So as a naturopathic doctor, some of the things that I'm kind of screening or checking for is high blood pressure, sleep apnea, which a lot of people don't realize can impact your fluid balance and can cause urination, as well as diabetes. So definitely there are some like medical conditions that could cause this, but are there other things you're seeing as a pelvic floor, like habits or things that people are doing that make it more likely that we're not able to make it through the night without peeing?
Mm-hmm. I mean, and really a lot of the habits that I see are I drank coffee all morning, all throughout till 2 o'clock in the afternoon, realized at that point I'd had no water to drink. And that's where I start drinking the water. And now my body's trying to hydrate myself, but you know, it's taking in too much. So I like to recommend, I mean, again, I'm not a nutritionist or a dietitian or have any background in nutrition, except for the minimal I took in university. But I do like to encourage that before someone has their first coffee to at least have 1 glass of water.
Mm-hmm. I love that.
Mm-hmm.
And then can we talk about how many women are peeing their pants?
Yeah, like with incontinence?
With incontinence, this is another thing, especially if you've had kids. It's like a running joke that obviously I pee my pants when I skip rope, or like, oh my God, I can't go to the trampoline park. I'm going to pee myself. Like, it's just this thing that we accept and think is completely normal. So what are some of the different types of incontinence that a woman can experience?
So the first type, let's bring it back to what we've already been talking about with going just in case. So that is something that we call urgency. There's also something called urge incontinence. So urge incontinence is when you get that urge to urinate, and sometimes it can come out of the blue and you have to go to the washroom now. And sometimes you don't make it to the washroom. So you maybe get to the washroom door, but as you're pulling your pants down, you start to urinate. Or a big one is when women get home, they put their key in the door. That's called latchkey urgency. And suddenly they have that overwhelming need to urinate and they are not making it to the washroom on time. That's actually something that I suffered with like as a child all the time. Like I would come home from school. I remember once having to pee in the bush outside my house because I could not find our spare key and I was locked out. And I was like, well, I'm going to have to go right here. So I peed in a bunch of hostas in our backyard. So that kind of urgency is very much, or that kind of urge incontinence, I should say, is related more so to urgency, where we A, have trained our bladder that we have to go very frequently, but B, that's a lot of self-talk as well. When you put the key in the door, typically we've told ourselves, okay, like I'm in the car picking up the kids and I'm going to go to the bathroom when I get home. Then your bladder and your brain have a miscommunication of what home means. So you put your key in the door, your bladder goes, you're home, and you start to urinate.
That's fascinating.
Yeah. So we can actually just change our mindset, change our self-talk. And instead of saying, I'm going to go when I get home, we say, I'm going to go when I'm sitting on the toilet and my pants are pulled down. And it can take a little bit of practice, but it's usually not much. And when I tell clients this, they look at, I feel a little guilty sometimes charging people for that advice because it's so simple, but it really does work. And when I said I had lifelong urge incontinence, I can now have to go to the washroom, leave work, go to the grocery store, talk to a neighbor outside, and still make it to the washroom very calmly. So it's a combination of deferring the urge, but also that self-talk. And then we have stress urinary incontinence. And that's the one I think people are more familiar with. That's when we're skipping rope or coughing, sneezing, when we're putting extra stress on our abdomen and our pelvic floor and urine leaks out. Very common as well. I mean, and again, this is not just a postpartum thing. This can happen absolutely to young women. It can happen to kids. And And typically can be one of two reasons. Either our pelvic floor has too much tension or our pelvic floor can't generate enough tension. So it's really hard to diagnose without actually being seen by someone. However, it really is it's more so about managing pressure. So if you are coughing and we're just letting all that pressure push downwards towards our bladder and pelvic floor, then we're going to have that little bit of loss of urine. And so a lot of women will say, well, I squeezed really hard and I still leaked. And I'm like, well, yeah, you made your pelvic floor like a cement floor.
Right.
And my analogy is always, would you rather jump out a window onto a cement floor or onto a trampoline? So we want our pelvic floor to be able to take up pressure, but then also rebound.
Okay.
Mm-hmm.
I'm like still amazed at the I'm going to pee when I get home. Like our brains are so powerful.
I know.
That is such a like potent reminder. And what you said earlier is so important. And this is why I think it's so important for women to see a pelvic floor physio, because I think the easy assumption is that if I'm peeing when I sneeze or I cough, my pelvic floor is automatically weak and therefore the answer must be Kegels. Mm-hmm. And what you said is that that's not always true. Sometimes it's actually that it's too tight and things can't release or relax. So that's why I think it's so important for women to get a proper assessment. And one of the things I always tell my patients when I'm telling them to go get a pelvic floor assessment is I'm like, it compared to a pap test, this is like a walk in the park generally for most women. I'm like, there's no instruments being used.
No.
So for most, like if you can manage a pap test, this is going to feel so much more comfortable and you're not exposed in the same way. Because I know for some women that is probably, I assume, a barrier to care, that it's obviously a delicate exam and it can be very sensitive for women. But in my experience, you guys do such a gentle, amazing job. So please don't let that stop you from getting care if you need it.
And the number of women that come into my office and they're so nervous about the internal. And once we do it and they realize, okay, there's no speculum.
Yeah.
I typically only use one finger because I can get a lot of information that way.
Yeah.
I like to sit next to the table, not at the foot of the table. So it's not like a pap where someone's head is right there. I'm talking to the person. I'm making eye contact with the person. Mm-hmm. And really my goal is to make people as comfortable as possible. And the nice thing is you don't have to wear a paper gown, which makes a big difference too, because those things are terrible.
It does. They are terrible. One of the things that you taught me, which I repeat a lot, is that your vagina is a self-cleaning oven. So can we shift gears a little bit from bladder and talk more about vaginal health?
Absolutely. So there's a big misconception that we have to clean our vaginas. Yes. There's so many different products on the market that are, promised to help with your vaginal pH and, make sure that you smell fresh. But your vagina really does self-clean. It's very good about removing things like discharge, blood, things that it does not want inside, and managing its own pH. So when we start to introduce products that maybe are scented or have chemicals in them that are promising us to change our pH or our vaginal scent, that can actually mess with the scent, right? And then you think it's a you problem and you go, oh, I need to get more of this product to use. And oh, I need to try this product now. But really your vagina can clean itself. Now, being mindful that your vagina and your vulva are different. So your vulva is like the outside area. The vagina is really the hallway that is full of mucous membranes that attaches the cervix to the outside world. So it's the inside of the vagina that is self-cleaning. Now, the vulva, where there are mucous membranes, we also don't necessarily want to clean with soap, but you can use a mild soap on the dry areas. So I explain that as like the area between like your thigh and your labia. You can use water. You can use a gentle cloth. So there are ways if you're feeling like there's buildup or something that you want to feel cleaner about, there are definitely things you can still use. But like even vaginal wipes, don't necessarily recommend to people unless they're unscented. That typically is okay. But really just warm water and like a clean cloth is all we need to keep ourselves clean.
I get so much resistance when I encourage women to do this. And I think part of it is there's still there's this weird idea that our vaginas are dirty and that they're unclean and unhygienic and they need to be washed and scrubbed. And we're, like you said, we're actually making things worse by over cleansing and being like too hygienic sometimes.
Yeah. And that's where we end up with like yeast infections or bacterial overgrowth.
Irritation.
And then you're itchy and uncomfortable. Definitely does not have to be cleaned with soap or product. Water, absolutely, because we do want to remove any excess discharge, but not soap, not scrubbing. This is mucous membranes. They're very, very sensitive.
Absolutely. One of the things I love to say is that our vaginas are like a killing machine because they are so acidic. Yeah. So one of the things that Lisa mentioned is that especially pre-menopause, our vaginas are extremely acidic and they're designed to be that way because that helps to clean and get rid of things that don't belong there. So there's only certain types of bacteria that can grow there. If sperm tries to get in at the wrong time, it will get killed and removed very quickly. But one of the things that happens as women move through their perimenopause and menopause is that there are pretty significant changes to the pH of the vagina. And this is one of the many changes that happen when women start to experience something called GSM, which stands for the Genito-Urinary Syndrome of Menopause. And basically, this is a fancy way of describing a lot of the changes that are going to happen in the bladder and urinary pathway, genitals, and sexual function. And this is a topic I think is really important for us to talk about because a lot of women don't realize, number one, that this is happening. So, and a lot of women don't realize, I think the stats are like 75% of women didn't realize that vaginal changes could be due to menopause or hormonal changes. But yet almost 80% of women post-menopause have these symptoms. So really important that we are aware of what is happening. And most importantly, that there are things that we can do to help support and keep the vaginal and bladder tissues healthy, especially post-menopause. Because sadly, a lot of women are uncomfortable bringing it up with their doctor. And a lot of times women are waiting for their doctor to ask and the doctor doesn't talk about it. So it often gets missed. What are some of the things that you're seeing, Lisa, as a pelvic floor physio, specifically with women going through either their menopause or kind of post-menopause?
Big concerns that I typically see are changes to how lubricated the vagina feels, how easily it is to feel lubricated when they're aroused. We see a lot of vaginal atrophy. So when we
can we talk about that? Because absolutely. I'm like, and this is how I like encourage them to get treatment. I'm like, you don't want vaginal atrophy. Like it's not a pleasant thing. So can you tell our listeners what that is?
So when we're going through menopause, all of our muscles start to atrophy. So we start to lose muscle bulk. That's why it's very important to strength train as we get older. Yes. The pelvic floor muscles are musculoskeletal muscles. That means they contract and relax voluntarily. So they have to be used as well. So if you're not using your pelvic floor, we're going to see that atrophy in and around the vagina. It means there's not going to be as much plumpness, maybe around the labia. There's not going to be as much plumpness with inside the vagina. So again, like any other muscle, it's like something that we have to use. Now, I don't typically recommend like, let's just do Kegels and that's going to fix everything because again, we want the pelvic floor to work together with the rest of the body. So I like to do a lot of functional exercise, teach women how to use their pelvic floor with movement, how to use it with your strength training. So it then becomes something that is very semi-automatic and we can build that plumpness back up in those muscles.
Another good reason to strength train is it's good for your vagina.
It's very good for your vagina.
Amazing. Good. Some of the other changes that I just want to highlight, like Lisa said, definitely less secretion and less lubrication. There's also a change in the type of bacteria. So typically when we are pre-menopause, the vagina is mostly lined with lactobacillus bacteria. Those are those good bacteria that hang out in the vagina. And as we go through menopause, we lose some of that good bacteria, and that creates more opportunity for not so great bacteria or yeast to come in, which often can, like Lisa said, make women more prone to yeast infections, but also UTIs or bladder infections. And there's also, I was kind of laughing as I was preparing. So not only are we losing collagen in our face, which I know no one is happy about, we are losing 75% collagen loss vaginally, which again is going to have a huge impact on what those tissues look like and feel like and how they're able to respond to just daily activity, but also definitely when we're wanting to have any kind of sexual activity. So, is this an area, like, is this a time where it can be really helpful for women to get pelvic floor physiotherapy to help with some of these changes?
Yeah, absolutely. So, along with muscle training, because that can help with like the plumpness of the tissue, which can make sex more comfortable. But a lot of what we do too is education. So what kind of lubricants to use. There's vaginal moisturizers on the market. There's one that has hyaluronic acid in it, which is exactly the same as the hyaluronic acid we would use on our face to help with facial plumpness as we get older. So yeah, a big part of what I do is educate people. And I talk about lube all the time at the clinic. I really don't like it when people go and just buy whatever they want over the counter, because again, when we're having change to bacteria within our body, the normal healthy bacteria, if we start to introduce products that have a lot of chemicals in them or parabens or scents or flavors, that can then also lead to infections. So I really encourage people to look for lubrication that is organic as much as possible, free from parabens, free from scents, and things like that. So for people that are typically under premenopausal, I typically recommend water-based products, and that's mostly because they may be trying to conceive. They may be using condoms at that point. And then I love with my menopausal clients, I like to recommend the oil-based lubricants. And the oil-based can also be really nice because it's a little bit like a moisturizer as well.
And I think we both agree, if you are doing something sexual, use some lube, my friends. It just makes everything more comfortable. It makes things feel better. And usually if we're doing something sexual, it's because we want things to feel good. And lube is such, like, it can be so helpful. So even if you're not overtly dry, please don't be afraid to use lube.
It can actually make your experience that much better. Even if you aren't experiencing dryness, it's still okay to use lubricant, and there's nothing wrong with you if you do. I at home have like 3 lubricants in my cupboard at all time. I have a water-based, I have an oil-based, I have a silicone-based, kind of depending on what we need it for. Yeah. And what toys you're going to be using, what kind of contraception or STI protection you're going to be using. And then you have everything that you need. And a little bit goes a long way, especially with the oil-based. A little, like a very small amount. A bottle of the oil-based would probably last you like 6 months.
Yeah, absolutely.
If not longer.
And yeah, it makes, again, it's been shown to like higher ratings of pleasure, more ability to orgasm. So get some lube. And like Lisa said, be a savvy shopper, because one of the things that I learned, which I was horrified about in some of my menopause training, is that a lot of the brands that are available at your local drugstore, some of the most popular brands, actually can cause more dryness and irritation because the osmolality, which I will not attempt to explain, but basically the way that it's made actually sucks moisture out of the vaginal tissues. So yeah, check. Lisa has some great resources. I know you talk openly about lube, which I so appreciate. So if you want to find out, I'm sure Lisa can share some recommendations with us.
There was also, just quickly on some of the drugs, like the very popular drugstore brands, and I won't name specific names, but there's also been some studies to show like how far from our normal pH some of those drugstore brands vary. And so it's really just changing our whole vaginal flora as well.
Yeah. One of the things that I know you recommend, and certainly something that I prescribe a lot, especially if we're speaking about women post-menopause who are experiencing vaginal changes, is vaginal estrogen. And this is something that we're starting to see more of a conversation about, but it's still something I think a lot of women don't realize is an option. And we are seeing more women asking about hormone therapy and using hormone therapy, which is fantastic. However, a lot of women who use systemic estrogen will actually continue to have vaginal symptoms. So just because a woman is using either an estrogen cream or an estrogen patch doesn't mean she wouldn't benefit from vaginal treatment as well. And so I really want our listeners to know that vaginal estrogen is generally an incredibly safe and effective treatment for the symptoms of GSM, which again are the genital and bladder symptoms that a lot of women will experience with menopause. It is not connected at all with breast cancer. You can use it long term, and it's basically helping to put estrogen back into the vaginal tissues. It helps to bring that pH down to a more acidic level, which is what our body prefers. And it can really help in terms of sexual function, lubrication, and it's also been shown to help reduce the risk of getting urinary tract infections, which a lot of women are more prone to post-menopause because, again, the whole pelvic area changes, and a lot of women will find that they're getting more infections. And the reason I love working with pelvic floor is that studies have shown that when we combine vaginal estrogen with pelvic floor therapy, we get the best results, right? So we want to look at things from a hormonal perspective, but then you also want to have the expertise of your physio who's going to help you with some of the like physical and anatomical and muscular stuff. So I know that's something you certainly refer for. Mm-hmm. Is that something you've seen work quite well?
Absolutely.
That kind of combination?
Yeah. And I mean, again, I'm not a prescriber. So that's where I always say, like, go speak with your naturopathic doctor, go speak with your family doctor, have a referral to a gynecologist and ask these questions if this is something that's going to be right for you. And then we can see again that plumpness, like that vaginal plumpness come back. It's also great for anyone who might have a prolapse and need a pessary. There is a recommendation that they are on vaginal estrogen as well if you've had a prolapse, again, just to help with that tissue integrity.
I had such a funny experience the other day. So I was talking to a patient who is taking vaginal estrogen, and the question always is, well, how long do I take it? And my answer was, take it as long as you have a vagina. And she had a good laugh. But it's really important to know that of all the symptoms of menopause, this is the one that is chronic and that is progressive. Most women will at some point stop having hot flashes and night sweats, but the symptoms of GSM, the vaginal and bladder symptoms, generally continue to worsen over time. Mm-hmm. So you don't just want to use a moisturizer here and there. You really want to be proactive because, as Lisa said, if we don't care for this and if it progresses, it can cause vaginal atrophy, which is literally like a breaking down of the tissues, which can have a huge impact, not just on women's sexual function and relationships, but also just on your general quality of life. It can be quite disruptive. So this is a really good place to be preventative and to not wait till your vagina is super dry to do something, but to actually take care of it all along so that you are preventing some of these things from happening in the first place.
And also recognizing that one of the top 2 reasons why someone might end up in a nursing home is because of incontinence.
Wow.
Right? With the other top reason being a hip fracture. And so if you can help your vagina now and reduce things like incontinence, that's also going to help keep you out of a nursing home when you're older.
Wow.
Right?
That I didn't know that. Mm-hmm. So yeah, that's a very powerful reason to take good care of this area. Can we talk about just pain with intercourse generally? It's something I think a lot of women start to experience often in that menopause and perimenopause transition, especially if there is more dryness and vaginal changes. But we know that this can happen really at any age. So what are some of the common reasons why a woman might experience pain or discomfort with any kind of like sexual activity?
Mm-hmm. So again, there's lots of different reasons and there's lots of different types of pain with intercourse. So we sort of umbrella term them all as dyspareunia or vulvodynia. So, pain with intercourse, pain around the vulva. We can see this as young as teenage years. So a lot of my clients, one of my biggest clientele is young women between the ages of, let's say, 18 and 25 that maybe are having sex for the first time. Perhaps they've had a bad experience, like with a tampon when they were younger, and it just caused a lot of fear around sex and intercourse or any sort of penetration. So that's one of my biggest groups of people that I see. And then,
can I just comment on that quick?
Absolutely.
Because at that age, also, a lot of women are on birth control pills. And that has been shown for a small percentage, but for some women, because it tends to bind up testosterone, it not only can dampen sexual desire, but it also can cause vaginal dryness. And actually, for some women, it can cause a little bit of vaginal atrophy. So really important, even if you feel like you're way too young, if you are on the pill and you're having symptoms, that potentially could be contributing as well.
Yeah, absolutely. Then the second group that I see are postpartum. So maybe they've had a baby and maybe their body has said like, whoa, I don't know what just happened there, but I don't know if I want that to happen again. So I'm just going to not let anything go in or out of here. Yeah. And so that then becomes us having to retrain the pelvic floor that it's safe. It's okay to stretch. It's okay for the perineum to stretch. There may be tearing, so there may be scar tissue that we have to work on. And a lot of treatment revolves around desensitizing the area and showing the body that it's safe to stretch. And then the third group who experience pain with intercourse are typically perimenopausal, menopausal women who are experiencing more dryness, or maybe there is atrophy, so the friction doesn't feel as good. And so that's where we look at plumping up the tissue. We recommend lubrication. I recommend lubrication for all three of these. It just depends on what kind of lubrication, depending on what their needs are. But yeah, so all women can experience pain and intercourse at any time, or even at one point, like one snapshot in a relationship, right? It might be mostly fine, but there's like one time that like, oh, I wasn't as aroused as I typically am, or we tried a different position that didn't feel as comfortable. Positions can make a really big difference as well, depending on how your cervix sits, depending on how your specific body is. There might be positions that you don't like or you do like, some that are more or less comfortable for you. So then it becomes a matter of, well, I don't just love to say, well, avoid that position. I mean, that's a really easy way to give advice, but I also like to then let's try to figure out what's happening in that position that your body doesn't like.
Yeah. I think it's very common for, like Lisa said, for women to experience pain or discomfort with intercourse, but I think we have to be really careful to not normalize it and just assume that is something that is part of being sexually active. That if it's something that's persisting and happening on a regular basis, that there are often things that we can do to make that experience more comfortable for you. And there's a urologist that I follow, and one of the things she says all the time, which I think is so great, is that if sex doesn't feel good, we are not going to want to do it, right? So if it's not pleasurable, if it's painful, going back to how powerful our brains are now associating sex as something that is painful and that hurts. Well, do you think your brain's going to want you to do that often if it doesn't feel good? Of course not. And this can have massive repercussions for women, especially in terms of their romantic relationships, right? If they're feeling like they can't be intimate, they're feeling disconnected, this can have a huge impact. And specifically for women who are post-menopause, a huge part of what's driving some of these sexual changes is the drop in estrogen. That is a natural part of menopause. So every woman's going to have their estrogen levels drop. But what I found fascinating is that research has shown that if your estrogen levels fall below about 180, you're going to have more vaginal dryness and more pain with intercourse. And if your estrogen drops somewhere below 125, you're going to have just less sex in general. The average postmenopausal woman, her estrogen sits somewhere below 40.
Wow.
So it's no wonder that so many women are noticing changes in vaginal health, sexual function, sexual pleasure. And again, the reason I want to have this conversation is that we have super safe and effective treatments that will keep your vagina and your vulva and your bladder happy and healthy, so that if you want to have sex beyond menopause, that you're able to, and that it'll feel good and it won't be painful.
Mm-hmm. And just another, to add to one of your points earlier, when sex is uncomfortable and it makes you not want to do it, and then your brain is like, I don't want to do this, we send a reflex loop as well, right? So then your brain says, oh, I don't want to do this. And your pelvic floor says, oh, I don't want to do this either. And it goes like, no, I don't want to do this. And it's very much like if you were told that you have to touch like a hot stovetop, right? Like your hand doesn't want to do it, you're going to pull it away. So your vagina can do the same thing and just sort of decide, no, I'm going to like tighten up and not let anything in. And so then there becomes an important need for things like talk therapy as well, to sort of help pass that and change some of that outlook and that mindset as well.
I learned so much from this conversation, Lisa.
Yay.
You're always such a wealth of knowledge and information. So if you are listening, what I want you to take away from today's episode is that while it is very common for women at all ages and stages to experience incontinence or urgency with peeing or pain or discomfort with intercourse or vaginal dryness, these are not things that we just have to deal with as women. They're not things that we just have to learn to live with and suffer through. There are so many, again, safe and effective treatments, including moisturizers and lubes and vaginal estrogen and pelvic floor physiotherapy. So Lisa, thank you so much for sharing your knowledge. Is there any parting words you want to leave our listeners with?
Oh, I want everybody to get their pelvic floor checked. I think every woman should have a pelvic floor exam at some point in their life, just so that they can understand that part of their body, because most of us have no clue what's going on down there. A lot of women don't even look down there. And we just need to create that connection with our own body. So 1, 2, 3 appointments can really help get that connection back and just make you feel more confident in your body as well.
Absolutely. And take some of the like shame and weirdness away that we still have around this area.
Yeah.
So I love that. Wonderful. Thanks for tuning in, everybody. And we will be right back here in 2 weeks. See you then. Thanks for spending your precious time with me today. If you enjoyed today's episode, it would mean so much to me if you would take a moment to leave us a rating and review, and share this episode with a friend who needs to hear it. If you're ready to get more insight into what's making you tired, find out which of the 5 most common types of fatigue you're dealing with by taking my fatigue fingerprint quiz at fatiguefixer.ca/quiz. Are you dealing with frazzled fatigue, where your body's exhausted but your brain won't shut up? Or maybe you're more of the drained fatigue type, where no matter how much sleep you get, you struggle to get up in the morning. Just take my fatigue fingerprint quiz and you'll have more insight into which labs to ask your doctor for and what habits and practices are best for fixing your type of fatigue. Find the quiz at fatiguefixer.ca/quiz. Because let's face it, accepting perpetual exhaustion as the norm, that's just not going to fly around here. Last but not least, I want to thank Jen Hudson and Mike Trutler over at Story Studio Network for bringing these conversations to life. I'll see you right back here in 2 weeks. Bye.